Hello friends, welcome to Expert Medical Coding. In today's video, we are going to learn about ICD-10 CM PCS updates 2023 fourth quarter part 2. In this video, we are going to cover two coding clinics. The first one is desmoid tumor and neoplasm of uncertain behavior of connective and other soft tissue, and the second one is sickle cell dactylitis and vaso-occlusive crisis. So let's get started with the first one. Desmoid tumor and neoplasm of uncertain behavior of connective and other soft tissue. Desmoid tumors are non-cancerous growths that occur in the connective tissue. And the update here is the code D48.1, that is neoplasm of uncertain behavior of connective and other soft tissue, was expanded to create codes to identify desmoid tumors of specified sites of the body, along with the code to capture other specified neoplasm of uncertain behavior of connective tissue and other soft tissue as follows. The D48.1 has been further expanded as D48110, desmoid tumor of head and neck, D48111, desmoid tumor of chest wall, D48112, desmoid tumor intrathoracic, D48113, desmoid tumor of abdominal wall, D48114, desmoid tumor of intra-abdominal, D48115, desmoid tumor of upper extremity and shoulder girdle. D48116 is for desmoid tumor of lower extremity and pelvic girdle. D48117, desmoid tumor of back. D48118, desmoid tumor of other site, and D48119 for desmoid tumor of unspecified site. D48194 for other specified neoplasm of uncertain behavior of connective and other soft tissue. Desmoid tumors, also known as aggressive fibromatosis or desmoid type fibromatosis, are rare types of tumors that grow from fibroblast cells. Fibroblast cells make up connective tissue in the body and are important for wound healing. Desmoid tumors are most common in people between the ages of 15 and 60 and are more common in females than males. Desmoid tumors are locally aggressive tumors. They can invade nearby tissue. However, desmoid tumor cells do not spread to other parts of the body as cancer does. They can attach and compress vital organs, but they do not occur within vital organs themselves. While some people with DTs have symptoms such as pain or swelling around the tumor, others are asymptomatic. Desmoid tumors can occur anywhere in the body since connective tissue is everywhere. However, there are four typical areas. They are intra-abdominal retroperitoneal pelvic cavity, extremities, shoulder and pelvic girdles and chest wall, head and neck, intrathoracic, and abdominal wall. This information is clinically valuable because location is strongly linked to morbidity and mortality. Desmoid tumors are often excised and may be surgically ablated. However, they may be difficult to completely remove, particularly when nearby tissues are infiltrated. Even after apparent complete removal, local recurrence is common. Medical treatments include either systemic or isolated lymphofusion chemotherapy, kinase inhibitors to arrest tumor progression, hormone blocking agents such as tamoxifen, and radiation therapy. Because the behavior of the DTs is unpredictable, active surveillance is the frontline approach. And the next coding clinic is sickle cell dactylitis and vaso-occlusive crisis. Let us first see what is sickle cell disease is. Sickle cell disease is a condition in which red blood cells become crescent or sickle shaped due to genetic mutation. These sickle red blood cells do not bend or move easily and can block blood flow to the rest of the body. Now let us see what is vaso-occlusive crisis is. A vaso-occlusive crisis or VOC occurs when sickled red blood cells block blood flow to the point that tissues become deprived of oxygen. What is dactylitis? Dactylitis is severe inflammation and swelling of the finger and toe joints. So the update here is new codes were created at category D57, that is sickle cell disorders, to identify distinct type of sickle cell disorders with dactylitis as follows. D57.04 is for HBSS disease with dactylitis. D57214 for sickle cell HBC disease with dactylitis. D57.414 for sickle cell thalassemia unspecified with dactylitis. D57.434 for sickle cell thalassemia beta 0 with dactylitis, D57454 for sickle cell thalassemia beta plus with dactylitis, and D57814 for other sickle cell disorders with dactylitis. Sickle cell disease usually presents early in childhood. Vaso-occlusive crisis or sickle cell pain crisis, an acute episode of pain, is usually the primary presenting morbidity associated with SCD. Vaso-occlusive crisis occurs when microcirculation to an organ is obstructed by sickle red blood cells that produce ischemic injury and cause pain. The incidence and severity of vaso-occlusive crisis are variable and may be an indicator for developing other complications of SCD that may be life-threatening, such as pulmonary hypertension, stroke, and splenic sequestration. Although pain can affect any part of the body, it often involves the joints, soft tissues, bones, and abdomen, and it may present as dactylitis. Dactylitis is a severe inflammation of the fingers and toes, commonly seen in infants with sickle cell anemia. Since early dactylitis may signify more severe disease, accurate reporting of the nature and frequency of dactylitis as a manifestation of the acute sickle cell vaso-occlusive crisis may lead to clinicians to early interventions to prevent long-term complications, morbidity, and mortality from sickle cell disease. Now let us see the question. And the question is, a 6-month-old infant with sickle cell anemia presented with fever and puffy tender feet and hands. The provider diagnosed sickle cell disease with dactylitis. How is this diagnosis coded? So we have to assign the combination code. That is, assign code D57.04 HBSS disease with dactylitis for SCD with dactylitis. Assign code R50.81 for fever presenting with conditions classified elsewhere as an additional diagnosis. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.